mothers and children which are sort of a slightly different situation where there are detention centers where children are being placed.
Alan, haven't you seen cases of children with bullet wounds and other evidence of violence?
Absolutely. And, when we talk about
Does that work when they're presenting their case?
Yes, absolutely. And that is why the Medical Legal Partnership is so powerful, because we can uncover medical and mental histories that have never been uncovered before, that the lawyers can uncover, and then we could use that evidence in testimony. A really interesting statistic for adult asylum seekers is that if you're an adult asylum seeker and you have had a medical evaluation, you have approximately an 85% chance of winning your asylum case, compared to someone who doesn't have a medical evaluation winning about 15% of the time. There's no statistics for children, but in our own work, we have seen how powerful that medical and mental health testimony can be.
So it's a psychological evaluation as well as a medical evaluation.
Absolutely.
And a lot of these kids would have experienced trauma.
So going back to the root causes of violence, the root causes of the children coming here in the first place, in a couple of studies that were done in children in detention by Women's Refugee Committee and the United Nations High Commission of Refugees, they have shown that upwards of 80% of children say that they have left their countries because of violence. Another really important factor, other than the poverty, which most of these children come from, or extreme poverty, is the actual physical and sexual abuse that happens in the household. And that was something that surprised me, although it was found in other studies. And it really points to the lack of protection that children and families have in those countries. So these children are fleeing because they have no other option, and the risk of taking this journey, this perilous journey, 2,000 miles to the US border, sometimes on the top of a freight train, is worth it for both the families and for the children to get to this country rather than stay in their home country and risk being killed.
And when they're on those freight trains, sometimes they become victims during that journey.
Absolutely.
Now, how do these kids come in contact with your organizations? Do they get in touch with you, or do you get in touch with them?
Well, I think what the Children's Defense Fund is advocating is that at the Office of Refugee Resettlement, that they provide information about all of these social services and all of these great organizations like Terra Firma that can provide services for the kids before they leave and go to their sponsors, that they connect them with health coverage, they connect them to schools, and they connect them to these organizations, because on the legal piece, as Alan mentioned, sometimes they're not going to talk about what happened to them in their home country. They don't want to talk about it. It's been so traumatizing. So this care that they provide us at Terra Firma and other organizations is trauma-informed care, which will help in the legal cases and help them make their claims.
I'm speaking with Kimberly Chin, who is the New York Deputy Director of the Children's Defense Fund. She has more than 15 years of experience in advocacy, nonprofit management, and policy analysis in the areas of health, income supports, nutrition programs, immigration, and poverty on behalf of children and families. And Alan Shapiro, who is Medical Director and co-founder of Terra Firma, also Senior Medical Director for Community Pediatric Programs, a collaboration between the Children's Hospital at Montefiore and the Children's Health Fund. And we will continue our conversation after this.